I'm very grateful to GBCHealth for giving me this opportunity to tell you about the study that I'm currently conducting. My name's Elaine Baroua, as you've been told, and I work for Apt Associates as a health economist. Now, we've been asked by the private sector delegation to the Global Fund to do a study to evaluate the contribution of the private sector in cash terms to the Global Fund. I'm doing this study at the moment with GBCHealth and TropMed Pharma Consulting. So why are we doing this? Everyone in this room is here because you care about having an impact on global health. And what we think is that your efforts are undervalued. And we'd like to correct that with this study. There's two reasons for doing that, and Michael alluded to them. We need to understand what's being done now because we know, and the next panel is going to discuss it, we know that you're going to be asked to do more. Now, if we are going to look at doing more, we've got to understand better what it is we're doing now. Now, in cash terms, we know what the corporate sector is contributing to the Global Fund. Over the last 10 years, $2.1 billion has been given to the Global Fund, of which about $200 million has been provided by the corporate sector. The thing is, that's not the only way that you contribute to the Global Fund. So if we think of the Global Fund at two levels, the Secretariat and country programs, cash contributions, we know about those, but you also supply things like commodities, test kits, sometimes at full price, sometimes at no cost, at no profit, no loss, and sometimes for free. Those can be considered part of your donations. At the country level, you do many activities. We've already heard about some of the great things that many of you are doing on your own at the country level. But specific to the Global Fund, you provide preferential discounts on services such as financial services and so on. And because the private sector is such an important part of the whole concept of the Global Fund, you're written into many of the grant proposals that are submitted to the Global Fund and that are funded. So you make a large contribution in ways other than just pure cash. So what I'm going to talk to you about this afternoon is two elements of the study. The first one is looking at the commodity supplies and talking to you about how we intend to value them. Why is that a little bit tricky? Well, I'm fairly charming, but with all the charm in the world, there's no way I'm going to persuade you to tell me what did it cost you to produce 1 unit of the good that you sold to the Global Fund? You're not going to tell me that, are you? So I've got to find other appropriate, rigorous methodologies to make that valuation. And that's what I want to talk to you about this afternoon and give you a brief description of some of the other things that you've told us about what you do in countries. So, cash contributions, public information. Commodity supplies, relatively public information. There's a database that tells us at what price all of your goods and commodities have been sold to Global Fund programs. We're also going to be using surveys. And so if you are from a company that's received a survey, I do hope that you'll complete it because that's valuable information for us as we complete the study. We're also going to be talking to portfolio managers at the Global Fund in Geneva to get a full picture of the contribution that you make. So I mentioned commodities and supplies. I also mentioned that you're not going to tell me how much it cost you to produce them, and that's fine. So let's look at the prices at which these have been given to sold to the Global Fund. One way of doing it is just to ask, well, what's the percentage discount that you give? But the question would be the percentage discount on what? This table just shows you the range of prices at which one antiretroviral is provided to Global Fund programs at. It can be anything from $23 all the way up to $208. So I can't really ask you what's the percentage discount on that good because it doesn't make any sense. There's a huge range of prices. In one single country, as that bottom line tells you, a single drug can be provided to South Africa at anywhere between $25 and $208. So that approach isn't going to work. So what we thought we would do is let's take a reasonable comparator. So if we look at the price at which the drug is sold or the commodity is sold to the Global Fund, and we look at a reasonable market comparator, this difference here could be called the contribution. So we've got a solution, right? No, it's not as simple as that. What's the comparator price? So if you're a commodity supplier, shall we say in the red corner, you can tell that I'm really objective. In the red corner, you might say, well, the USA market price is the reasonable comparator, and that particular antiretroviral, and these are real prices and real drugs, is $221 in the US. If you're an Indian manufacturer, you might say, well, in India, we sell this drug at 109. And so I could use those prices to estimate the value of the contribution. But what if you're not in the red corner? What if you're over here, and you're looking at it from the Global Fund's point of view? If you're in the gray corner, what you might say is, well, wait a minute, but that's not the price that I actually face. The price I actually face is different. So the Global Fund can actually procure this particular drug at about $48. That might be the comparison price they want to use. They might also say, but the Clinton Health Access Initiative has negotiated $30 for this same drug. Maybe we should use that price. So it really depends who you are, if you're in the red corner or if you're in the gray corner. That determines what that estimate will be. And this bar chart here shows you, if you're in the red corner and we use the US market price or the Indian market price, the value of that contribution could be anything between $50 million and $20 million for one drug over 3 years. But if you're in the gray corner and you're using a comparison price as per your viewpoint, say you're the Global Fund, the value of that contribution drops to $5 million, possibly to $0. In this particular case, the Clinton Health Access Initiative has negotiated a price that's lower than the average price at which the Global Fund programs buy. So the methodology that I'm describing, comparing to a market price, really is, the results are really going to depend on whether you're in the red corner or you're in the gray corner. But it's important that we identify this. Fortunately, I'm not the person that's going to pick which of these valuations we're going to use. We're going to wrap the study up by September, and we're going to hand it over to the private sector delegation and the Global Fund, and they're going to decide what is the approach, which of these comparisons makes the most sense for them. Now, I mentioned that's only one way that you all contribute, and today we've had lots of examples, actually, of other ways. Preferential discounts for services, direct grant support, and so on. All of these are contributions because they cost you money to do them. Now, it's true that you do what you do really for the lives, for the people, but you also appreciate the bottom line. We really do need to know what it is you're contributing in cash terms. And so the surveys that we've sent out, I hope that you're all going to provide information on, will help us understand what it is you're doing in countries in cash terms, not just the very beautiful pictures that we've been allowed to see and the great stories that we've heard today, but what your actual cash contribution is. So some examples. Chevron, who's been talked about a lot today, so I'm not going to talk about it too much, is a significant cash contributor to the Global Fund. But in addition to that, they provide valuable support in terms of capacity development at the country level, in addition to their own programs for their own workforce and for the communities in which they work for. Standard Bank provides financial management expertise, provides their financial services in some places at a discount, in addition to which they support the principal recipients of Global Fund money and program implementers to strengthen their capacity to do solid financial management of their programs. And lastly, but not least, Takeda Initiative, another example, a cash contributor, but in addition to that, they spend their own resources through their endowment to strengthen health systems. Very important work, and it's not the sexiest work that you could all be doing, but it's so critical. As we talk more and more about integration of HIV programs into the mainstream family health and MCH health, we're going to take strong programs. We're not, hopefully, going to put them into weak systems. So the types of investment that Takeda are making in strengthening health systems are absolutely critical to making the Global Fund grant impact as large as it possibly can be. So we're going to take both of these pieces of information on the donations through the commodity supplies and the donations through all these other approaches that you use to strengthen the response to HIV, AIDS, TB, and malaria. We're going to put them all together in a report we hope to be done by September. in good time for replenishment, and hopefully we'll be able to have a good picture of where we are now, so that during replenishment we can have really good talks about where the corporate sector would like to be over the next few years. Just before I go, I'd like to say thank you to all of you for giving me your attention for a few minutes. Also to my colleagues at GBCHealth, Farida Etisham and Whitney White, my colleague Ian Bolton at ChopMed Pharma, and my own colleagues at APT, Anne Lyon and Michelle Abbott. Thank you very much for your attention.